We're next going to go to Xavier Amatriain. Xavier is at curai.com, co-founder and CTO, and he'll be talking about AI for COVID-19, an online virtual care approach.
Thanks so much, Russ, for the introduction. I'm really grateful for the invitation to the conference, and also humbled to some extent represent many startups that have poured their hearts and souls into addressing this crisis situation and working on coronavirus-related things. Now, also, sorry, I wanted to mention two people, because if this was a regular conference, I would have them on the stage, but the logistics are complicated. Both Jeff So and Anitha Kannan have helped tremendously in a lot of the research that I'm going to be presenting. Jeff So is our head of clinical informatics. He's also an assistant professor at Stanford in the Department of Primary Care and Population Health, and Anitha Kannan, who is our head of machine learning research. Now, before I dive into some of the COVID-related efforts, let me add some context about what we're doing at Curai and what I'm talking about here. I'm sure most of you will agree that there were big inefficiencies and deficiencies in the healthcare system that were well known before this pandemic, right? And those include things like lack of accessibility to healthcare services, physician shortage and burnout, medical errors. Now, COVID-19 has not only exposed, but also augmented all these shortcomings, putting a huge stress in the whole medical system. Now, that has motivated many to propose telemedicine or telehealth as a solution. But the reality is telehealth by itself only solves some of the problems. In fact, telehealth is mostly a different medium for the same processes and practices. Very importantly, it does not scale or improve quality by itself. In fact, scaling telemedicine through AI was exactly what we were working at Curai when this crisis broke out. So we decided to put our efforts into coronavirus-related features. Now, what is the solution that we're proposing? We are proposing an end-to-end medical platform that is always on, accessible, and affordable, and where we combine latest technology, AI, and automation, of course, and providers in the loop to accomplish both scale and quality of care. And we design our system to be always learning from the data and to operate in the wild. How does this look in practice? Well, as you can see here on the screenshot, and on the left, you see the patient client, the one that you can download and install in your phone or use from our web. And on the right, you see the provider client. And it is primarily a chat-based application that allows for synchronous and asynchronous communication. And there's an end-to-end integration of AI, both in the patient-facing and the provider-facing application. The provider tools might sound familiar to some doctors in the room. They include sort of like a new generation EHR built on top of the well-known FHIR standard, but includes full-on automation and decision support. And the platform, as I mentioned before, is designed to capture data and improve and learn over time. Now, going into what we've done for COVID-19, it includes a lot of different AI power features that I will just try to summarize in the following slides. Let's start with our automated diagnostic assessment. This diagnostic assessment is based on the latest known recommendations and research as of today. It's constantly being updated. On the surface, it may look like some other COVID symptom checkers out there, and I know some of them have been referenced in the conference already, but there's much more to it. One of the things we have is this is a dynamic questionnaire that adapts to responses in the flow. For example, in the third screenshot, you see that if you've answered that you are a healthcare worker, then you will be asked whether you've interacted with patients with COVID-19. And the assessment is also based on personalized features, including, for example, when we're asking on the fourth screenshot, the zip code, this is including the latest known incidence of COVID-19 in the area. But most importantly, this automated assessment offers the opportunity for the patient to then continue the conversation with medical providers, both health coaches and licensed MDs, to address any need. And this goes all the way to actually final diagnosis and a care plan, as you can see here on the third screenshot. We also include automated and personalized daily follow-ups, so we keep checking on the patients over each consecutive day. What we're still working on, there's more features. One of them, very important, we have already added at-home testing capabilities to our platform. We are unfortunately still waiting for the FDA to approve. And we're also in discussions with existing healthcare systems who are thinking about using our platform sort of like a front end to their own healthcare systems. Okay, so I've talked about some features that are already in the product, but since we started at Curai, we have strongly focused on research. And we've done research in medical diagnosis, NLP, image processing. Here's a highlight of some of our peer-reviewed publications in the last couple of years, some of which have been in collaboration with Stanford and also MIT. And now we are applying some of that research to COVID-19 scenario. As a first example, in one of our previous publications, we use a double fine-tuned BERT language model to identify similar questions. The pre-trained language model was fine-tuned on a medical Q&A task and then on medical question-question similarity. We're now applying that with some slight modification to the COVID case. Now, why is that important? Well, we're implementing an automated question answering feature with the goal of providing a much better user experience to people looking for COVID-19 information. So instead of navigating through a long list of questions, the user can then input their personal question and be directed to the most relevant ones. Also, importantly, to avoid misinformation, all our answers are curated. And because a simple answer might not solve the concern or the problem, we again have the opportunity to connect directly with a provider. Okay, and finally, I'm also very happy to share that we have now trained what, as far as I know, might be the first machine learning COVID-aware diagnosis model. We have used the same approach described in our Learning from the Experts papers that you can see here. The basic idea is to use an expert system as a prior and simulator to generate clinical cases. Then the simulated cases can be combined with any other data, such as, for example, data from EHR. What we have done now is we have added data coming from our COVID assessments in the product. This is a great example of the ever learning feedback loop that I mentioned earlier. And now we have a fully COVID-aware diagnosis model. Of course, at this point, it is hard to evaluate the accuracy of the model just because there is no ground truth data at this point that we can test with. But we're very confident that this is going to be valuable and improving over time. And again, showcases how machine learning can be used from very early on to build these diagnosis models. So to conclude and highlight the main point of what I mentioned, healthcare needs to scale quickly now. The only way to scale while preserving or even improving the quality of healthcare is using technology and AI and automation. But AI cannot simply be dropped in the middle of all ways of doing things. We need to integrate it in an end-to-end system benefiting both patients and providers on both sides. Thank you.
Thank you very much, Xavier, for that exciting vision for where we need to go.